Hi everyone. Thank you so much for taking the time to listen to this video. My name is Onyeka Nkentra and I am a student at Truman State University. Alongside with my capstone partner Hannah Bateman, our goal is to educate the priority population on the flu and flu vaccines. This discussion will contain two videos. We will explain all of the fundamentals of the flu vaccines. In the first part, I will be discussing how flu vaccines work, the signs and symptoms of the flu, the risks if not given the flu vaccine, and herd immunity. In the second part, Hannah will be discussing the benefits of getting the flu vaccine, the misconceptions of the flu vaccine, and also places on where to get your flu shot. We will be answering everyday questions about the flu. We hope you enjoyed. The first question we want to ask is, how does the flu vaccine work? Flu vaccines allow the antibodies to develop 2 weeks after the vaccination. What are antibodies? Antibodies are used to destroy the infections and antigens. So when we say an antigen, we mean any substance that is toxic to the immune system. So in this case, we're talking about the flu virus. Viruses are an example of antigens. So when the flu comes, your body is prepared and it can fight off this virus. So let's apply this to your child. Your child this antigen or antibody, sorry, will give your child the superpower to allow him or herself to protect her body from the flu. That would be a great advantage to your child's health. Is the flu vaccine bad for you? The flu vaccine is beneficial for your immune system because it's a source of primary prevention. Primary prevention is how we prevent illnesses before the illness is encountered. The flu virus does n- the flu vaccine does not contain any harmful chemicals or toxins. The ingredients of the flu vaccine includes egg preservatives, egg proteins, preservatives, and some antibiotics. The CDC the CDC has stated that there is no association between the flu vaccine ingredients and uh, disorders such as autism or Alzheimer's. Mercury-based ingredients do not cause autism, according to the CDC. Why, why is it especially critical for children under the age of 5 to get their annual flu vaccine? According to the CDC, children under the age of 5 are at serious risk for the flu-related complications. These complications include pneumonia, headache, nausea or vomiting, sinus infections, or even more severe ones such as death. The CDC has also reported that 143 pediatric deaths have occurred due to the flu in the 2018-2019 flu season. What are the symptoms of the flu? Before being diagnosed, it's important to recognize the symptoms of the flu to better protect your child. These symptoms include fever, cough, running or stuffy nose, muscle body aches, and fatigue. Again, this is more common in children. What are the risks if my child doesn't get his or her flu shot? We understand that before this time, people have not taken the flu. People associated the flu as just a seasonal allergy or something that will go away. But the flu can actually lead to something even worse if not taking precaution. We are in the time of a global pandemic. We have the coronavirus that people are taking high precautions by staying 6 feet away and wearing masks. And this is how serious we should take the flu. We should always wash our hands and eat healthy food that will help our immune system. We can compare this to traveling. So when you travel, most people take traveling most people travel by driving because it's more convenient and easy to travel with. However, people don't think about the safety. Flying is actually a safer way to travel according to research studies. So